we just wanted to show you how we wanted you to do the physical therapy in the immediately post-op period for your dog, who's wonderful, named Emmy. And she had a medial patella surgery, and we moved her tibial crest, was the most important thing we did. And what I want you to do is twice a day for 25 repetitions is to flex and extend each joint. So I'd actually do every single joint in her right hind leg, 25 repetitions twice a day, in addition to the icing that we're going to continue to do for another at least 5 days of icing. And so that would, if you did that another dozen times, you'd be done with her foot. The next joint's a little harder because the hock joint and the knee joint are going to have to move together. You can't move them individually. And obviously this is where she had her surgery, so she's a lot more tender on that. So you want to just find how much she'll let you do. You're not trying to make her painful. But you want to flex and extend as far as she'll let you without significant discomfort, so that she'll continue to have excellent range of motion after surgery, and it'll speed her recovery, and it'll help decrease her muscle atrophy. So she's getting some discomfort from that. You're a good girl. You're a good girl. She says, ouch. Giving the anti-inflammatory and the painkiller an hour or more before this will help. So that's going great. And then lastly, you'll do her hip joint. We'll do that last. It's a good girl. You're a good girl. She had her surgery done yesterday. So each day we expect her to be a little less swollen, less painful. I don't expect your hip to hurt you, honey. Can I do your hip finally? Can I do your hip? So she's kind of flexing and extending her knee with her hip. And that's okay with me. And of course, when you ice her knee, ideally you'd be able to do this whole area and the inside of that area. The most important part is going to be the front aspect and the side aspect, is where most of her surgery occurred. And that's pretty good showing. Emmy, will you let me show you a little bit more hip flex and extend? Great, that's a super flex of her hip. And that's a super extend of her hip. We're also going to ask that you do a gentle massage twice a day. And so that could be rather simple, of course. It certainly doesn't need to be rigorous. It's okay, sweetie. I think she likes that. She's thinking about it. She has just a slight little bit of swelling of her foot, and that I expect to decrease every day. You're a good dog. Emmy's a good girl. Emmy says that's okay. That's all right. You can do that. If you were to feel a lot of heat or pain or to get discharge, of course, you'd need to contact us. The hard part's probably going to be resting her after the surgery while the bone heals from the reconstruction. See if she'll let me do the inside of her leg. Being a good dog. Being a super dog. She has a pin that's right here. don't want to rub on that. I think she'll remind you if you do. We're a little bit worried that if she's really good at it, she might find a way to lick her incision. If you see her able to lick her incision, we'll have to put a longer cone on her head. And that'll certainly make it harder for her to eat and drink and get around. Well, she's just doing awesome. I think she likes this. If you have any questions, let us know. Thanks. She's a little stinky.